Well, look at this, Renee. Another podcast. How close are we to 100 podcasts?
Oh my gosh, I think just a couple more and we're going to hit 100. Then that's insane for
A
us thinking we were
century.
never doing
A
this.
century of podcasting.
I know. That's pretty cool. I like it. So we're almost there. Yeah, we're at 98 today, I think, which is pretty
Yeah.
cool. So, what is happening on the farm here in this July heat? What is going on with the corn and all the things? It's probably pretty hot,
Well,
isn't it?
it is hot, but we've had some torrential downpours. So there's been too much
Oh,
rain and then not
oh,
enough rain and then too much rain. So you know how farmers are finicky about rain, like it's
yeah.
never just right. So I'm holding out for just right rain, but we're going into August. And as we head from July to August, this is always when the grass turns brown and generally it gets dry. So we count on the moisture we get all through the month of June. But I want it to be the perfect amount of moisture, not too much so it runs off and washes away, but not too
Yeah.
little.
Well, I'm
So,
here in the Des Moines metro, and starting in June, we had to do couldn't water our lawns, so we we're 100%
okay.
reliant upon whatever rain we get because of the nitrate levels in the
I was,
roads. And
yeah,
so
I
in the
was, I
water,
was blamed. I was blamed for
you
that this morning. I was at a
you
meeting
shall be
and the
blamed for
people were
that,
from Des
Mr.
Moines and
Farmer.
I said, I'm a farmer. You can see it's validated in these different places this month. And they looked at me and said, "So this is all your fault. I can't
This
drink the
is all
water."
your fault.
Yep.
Well,
Yep.
that's a myth about not drinking the water. So there's actually articles that came out right after all of this was going on about people shouldn't be afraid of the water, blah, blah, blah. So it's caused a lot of panic and weird things about what they should and shouldn't
I
do and
know.
all the stuff. But and the nitrates, from what I understand, could be around a while. So by the time this podcast comes out, we still may not be watering. So I'm excited about the
Right.
rain myself because that's the only way I'm going to
Right.
have any kind of grass that looks like grass. So
That's right.
you
That's
got to
right.
take it for where it comes. So today
More.
we're talking about buildings, and that may be sounding like, well, that's really strange, but let me kind of give you all some preference. So Jason and I have been a part of, I do not know how many projects that come with a free building for behavioral health.
Yep.
And it starts with, hey, this hospital closed, this program shut down. We've got this building, and we would like to then make it behavioral health. And the building, the free building, the dollar building is absolutely never the problem in the situation. It always is everything else that goes with it. So I know along our journeys, we've talked to architects who also get in that space because then they have people who want to build new buildings and they want to do it for behavioral health, but then they don't necessarily think about the things that are absolutely needed in behavioral health space. And then you and I can walk through a brand new building and go, nope, that's not going to work. And then they're looking at you like, what do you mean? And like, well, that's actually dangerous for these reasons. And you shouldn't have those types of light fixtures and these types of cords and just all these things. So today we're going to talk about bringing people together and building these social hubs and talking about all these crazy building conversations that we land in and some of the professionals that we worked with along the way. So Jason, kick us off. Talk to us about some of the people that you chatted with the last
Well,
conference you were at and why you want
you
to talk
know,
about this.
well, I think the first one we talk about, I kind of wanted to talk about it because I met with Todd at JLG out of Fargo, North Dakota. And the reason he wanted to talk with us is because he's still reading our report that we did in
Oh,
2022 in North Dakota when we were
wow.
helping to figure out how many beds need to be at the state hospital. If you remember at the time, we met with
Yes.
DHS and there
Yes.
were plans. There were already architects on board who were designing things that were pretty ridiculous, like not necessary, because at that time the legislature was trying to get a number for how much it was going to cost and who they should serve and how many beds they needed. And if you recall, we did a whole bunch of research.
We did.
I reminded a lot of people while I was up there because it's still known as the Schulte report, and I said, "Hey, I co-authored that second report, and so let's stop calling it that
Sorry about that.
because that's not helpful." Yeah, but anyway, it's
I
still the
know.
Schulte
We talked about
report.
this on the last
Um,
podcast. That's why we've changed
I
the
know
business name. So
it's
we don't have to do this
and it,
anymore. I don't know what in the world another report would be called after that. Who the heck
I
knows what
was
they
I
call it?
was in North Dakota last week and I had to listen to how many people come up to me and talk about I was with legislators and it was always yes, the Schulte report. I'm no
I
one.
know. I'm
Um,
sorry.
so I'm like all that testimony in front of the legislators I was connecting with. I'm like, I was right there. Anyway, the point
Yeah.
being is that was approved 300 million for a new state hospital
Wow.
and Todd and his team at JLG out of Fargo. They do healthcare and hospitals and critical access hospitals all over the country. This is their specialty. And so the first thing I asked him, I go, did the pool stay? Because if you remember, there had to be a pool when we were up there, right? I said, I'm asking for
In
Renee
North Dakota, of all
because
places.
there had to be a pool in the new design. He's like, we're cutting out all the stuff. Like, we're getting back to the basics. I go, did the pool make the cut? He goes, that was the first thing we cut, Jason. And I said, I like you so much, right? Because they were
Wow.
actually getting after it and coming up with a design that makes sense for the state and that's going to be lasting long term. And so, it kind of made me think about, well, let's talk about design and how important that design phase is of these projects, because it can take a decade, right? This state
Yeah.
hospital has been a decade in the making to figure out how many
Right.
beds. They landed on 140 beds. They landed on $300 million. And now it's up to those architects to design and come up with something and materials, and then to work with the contractors and actually construct the building. And so, that's going to be in place by 2027. And so, I'm excited, and I'm already putting on my calendar in 2027 to go up there to the ribbon cutting, because, it's exciting to be part of something, right? Even though that process took so long, we were a big part of helping to push that across the finish line. And so I like to remind people that when we talk about this process, we can't rush it. And, we're going to give some examples of where we've seen projects rushed, and then it didn't end up being what it should have been or what it could have been or meet the community need. Don't you think, Renee, that you've seen that
Yeah.
happen a lot of times as well?
Yeah. And, we've got some projects in the community around us that were great, intended, well projects that you've talked with and worked with that are sitting incomplete presently because they
Right,
didn't look through the budget correctly, or things changed along what they thought the secured money was, or different things. And so then you have half finished projects, or
right,
things that never got off the ground, or like, and you've talked about in other parts of our state where they never ever made money. They built it and it never came. And behavioral
right.
health, we are the worst. They think it's the field of dreams, build it and they will come. And no, it doesn't always work
Yeah.
like that. The people may
No.
come that need help, but the financing doesn't necessarily follow, and then you can't be in existence, or the workforce doesn't come. How many projects do we know now that they've put in rural Iowa, and you and I are scratching our
Mhm.
heads going, I have a huge behavioral health hospital not far from me, 5-10 minutes.
Right,
It's never been over 50% capacity because of workforce.
right,
So then we go build a humongous, won't say what, in the middle of the rural community, farther out. And then we wonder, how in the world are they going to staff that thing? And people don't want to talk about it. So in North Dakota, right, one of the senators really wanted to spread the hospital around instead of having it in one place. And last podcast we talked about it was constitutional in that place and things like that. But one of the
mhm,
biggest pieces was, the workforce. I did a particular project in Stark County, North Dakota, which is in Dickinson, the town, and they had a free
yep,
building. And I did a free building thing for them. And I looked at every single licensed anybody in any license medically around and so many miles away. And they just didn't have it. There's just no way. And so that project never went anywhere. Thank goodness. It saved them a lot
mm,
of time, effort, and energy and heartache, because how are you going to do that? Now, I don't know that that's what they wanted to hear, but it's like, I'm grateful that they talked about it beforehand, because it was, yeah, it's a great building, but then what, And so we don't talk about that enough. So how does this tie in though to the conversation about people? So I know you were talking about this, about the hubs. So talk to us about, what is a hub and how does that really connect to people?
Yeah, I think when we talk about building use, right? Like sometimes we limit ourselves, kind of like what you talked about, that we want to design it to do this one thing, to be an outpatient
Mm.
clinic. Well, that may not be what the community really needs. They may need outpatient services, but they also need primary care, or they need case management, or they need someplace for peer supports to occur.
Mhm.
And so when we design things and they're not flexible, or we design them and they don't make sense and don't fit into the community, then they go unutilized, right? And so if a building's in the wrong place, it's best not to use that building, right? And we see this a lot of times. There's pushback from architects where they want to design healthy communities, right? And so we have to think about, most architects who are reputable in healthcare, they understand trauma-informed care. They understand the social drivers of health. They understand all of these principles, and they try to put that into their building design. That's why I really appreciate, and we're going to put in the links, two really reputable architects that we've come across as we travel the country. We've had lots of conversations with, who who understand community design. We've talked about Zach at MKM, who's over in Indianapolis, Indiana before Renee, but they really want to design walkable spaces, outdoor spaces, how it connects to the greater community. And you're kind of talking about the tie together. I think we're going to talk in data that we oftentimes reference Bowling Alone, a book from 2000 that kind of talks about how our communities are changing and we're not connecting as a community as much as we used to.
Right. Well, I can think about it from my side on the reentry side. We have a lot of transitional housing that may be substance use focused, and there are programs that did a really good job of that and made themselves close to bus lines, close to
Yep.
grocery stores, close to, essential places that people need to be able to live. And then there's others that are just sporadically spaced because they got the free or low cost building,
Right.
and they're like, they can't get anywhere. And so when you look at the success of somebody reentering in the community, whether that's from a psychiatric situation or a justice situation, and they need to be able to get to where they need to get to. And so,
Mhm.
even if we're talking buildings, I have so much thoughts about buildings because that's been way many more conversations in my life than I would have ever expected because I don't do buildings. And when I talk to these, I've met these architects as well. And when I've talked to them, I'm like, man, am I sure glad to meet you because you do buildings. And we get asked about buildings all the time. And that's so not what I do. But I can tell you when it's wrong because
Right.
you can't get people to the
Uh,
places they need to be.
a, a great example we heard about was a small town in kind of northwest North Dakota. I mean, it's a small town, but it actually has like a mall in it. And I'm not saying it's a big mall. I'm just saying, it's a mall. And it's where public health is housed. And public health did a needs assessment and found out they need behavioral health and they need primary care.
Hmm.
And so they wanted to develop space so that they could do that alongside public health because public health does all the immunizations, does diabetes support. So it would be a good crossover if they could help to house a clinic of any type, right? Any size. And so they started down a path of building a new building, of raising money, of getting grants, and it fell through. And so what they ended up doing is taking the space they already had because they were in a mall, which was very accessible and had lots of foot traffic already. They gave up their offices to be in cubicles, which really wasn't a big given because that's how everyone is anymore. But they did that and they made space. And there was a local person who was moving back. Her husband's a farmer and she just finished her advanced registered nurse practitioner. And she came back and got the local rural health center and medical center from Bismarck to sponsor her. And so she works there and does primary care out of that office and uses the nurses in public health as supports. And they redesigned their space to adapt to that. Was it ideal? Absolutely not. But it held those principles up of being accessible in the community. And so here we have someone who's practicing primary care. She does her own boarding, her own patients. She doesn't have a nurse. It really is done differently. And so I think sometimes we forget how important location is, right? If that happened in a new building over next to the highway where you can't walk to it, it's not close to public health, it's not close to anything else, it wouldn't be near as successful as it is today. And so
Yeah.
it's really just important we take that all into account.
Yeah. Some of the things that some of corrections officers are doing are locating in with other law enforcement and kind of
Yeah,
co-locating different types of law enforcement
sure.
and being together. And you see where firefighters and law enforcement are co-located. There's reasons for that because they can the synergy of working together as a team and their first responses and who's available, those are really successful. And so you can see when those things are planned creatively and done in a way that they can work together, it's done well. But oftentimes when you get one of these free buildings, it's standalone all by itself. There's nothing else there. That becomes a very big problem. And so it's really fascinating to kind of watch that and people, think, oh, well, they're giving me blank, so I should do something with it. Well, oftentimes the city's trying to offload it so they don't have to pay the property taxes and whatever else. So it's not really a gift. It's something with a cost, and we need to think about that. So let's roll into the data. You mentioned the Bowling Alone book, but what are we seeing related to people and not really being in these hubs like we're talking about because of how, for decades we all built individual houses, individual places in the suburbs away from the community hubs. That's how this whole country was sort of founded. So what are we seeing because of that with this idea of this Bowling Alone situation?
Well, the Bowling Alone was kind of the first book that said, hey, look, there's less bowling leagues, which means there's less opportunity for people to go out and connect with other people in their community in a
Mm,
social way. And then we
mhm.
started to see workplaces struggling because people don't know how to connect at work anymore because we're
That's
working remotely. We're more isolated. And then recently, a study came out, I think March of this year, about restaurants. More people are eating alone.
mm,
74% of all restaurant traffic came from off-premise customers. So that's takeout, delivery, right? Uber Eats.
mm.
People call into the restaurant, get their food delivered to them, and they're not going to the restaurants, running into their neighbors, going to the local places that they used to. And so as we think about Americans living alone longer, young people living with their parents longer, we see this increasing isolation and a whole bunch of different metrics. We're going to put those in the show notes that you can take a look at some of that. And I think that's having an impact.
2 years ago, the Surgeon General put out that kind of groundbreaking information about isolation and how it was more dangerous for to be isolated than to smoke a whole lot of cigarettes a day or to be obese or many other social determinants of health that we've always watched. And isolation wasn't really one of those things that were on that list, and it jumped right to the top. And that was post COVID, so that was post shutdown and stuff. So of course that really exacerbated the issue. But these restaurants are saying, that this, like, even in the restaurant magazines, it's 8% down, just people coming to restaurants within the last year of the same time frame.
Mhm.
And what you were saying about people coming, in even younger generations are even less people going into restaurants or going together. So you think about where people meet others. I mean, if it's not the leagues, a lot of the other things that have closed down through the years are like your clubs. I know you're a Kiwanian, but there's not as many of those as
Right?
there used to be. Like my dad was an elk way back in the day. I don't know when the last time
Yep.
I saw one of those was. And so just some of those clubs, social groups, and it's going to be interesting to see how the next generations, what they do with this, because we've swung the pendulum to really isolated one side. So it's going to be interesting to see what kinds of community people want to build in these younger generations. And I think that's back to that conversation about the architects, where you're saying those
Right.
architects want to build those social hubs, but that's not always the
Right.
kind of projects they're getting.
Well, and so I think this is the tie together, right? When we think about design and we think about hospitals, how can they be the hub for the community?
Yeah.
And so we've seen some really great designs. It was actually, there's a new hospital that was just built in Rugby, North Dakota, Renee, and Rugby.
Oh, that's where John's
Our,
from,
right, our
our care
friend,
friend.
um, right, absolutely, is from Rugby. And the new hospital in Rugby was really designed around the concept of being a hub for the community. They were in a building that was built in the 50s. You couldn't even find the front door. It was kind of funny. A state senator was coming to the hospital one time. He had to call to figure out where the front door was because
Oh,
it was
wow.
just a building that was added on to a building. Very not friendly. Four
Not friendly.
stories tall. They didn't even use the top story. The roof leaked. And they recognized that they had to start over. And in their design process, the main hallway of the hospital that goes straight through, it was considered Main Street, and all of the specialties went off of that hallway. And at the very open with windows, and at the very end, there was a cafe. And they put more in time and space into the cafe and the gym because they wanted people from the community to come to the hospital, not for healthcare, but to work out at the gym, work with the trainers and also and the therapists in the gym, but also to come there for meals, for coffee, for Kiwanis meetings, right? There was space for all of those things to be part of the community. And I think that was really innovative because they've then established themselves as that anchor institution. People go there for other things and they trust the hospital as the place to be.
And if I remember correctly, that conversation also extended to having some of the areas within the hospital for Native Americans and specific color patterns and designs, because they have a large
Correct.
Native community, and they wanted to make sure that that community felt
Yep,
welcomed and part of that community. And so they were
absolutely.
talking about making some different types of decisions about maybe the types of music played or the types of open spaces like you're referencing, so that
Mhm.
they could have concepts and color palettes and things that would be
Yep.
welcoming to other people. And I thought that was a really interesting idea, because that's not one you hear a whole lot of. Might be up in Alaska you hear about that, but we haven't heard a lot about that
Right,
in a lot of places. But
right.
the Dakotas have a lot of I can't
Yeah.
say that word, Native American. Sorry, I can't say the other one.
Yes.
And
Native.
those
Yes.
people, I understand what I'm saying, but I can't say the words. So yes, so to be welcoming, because it's not big enough community to have two. And I
Hmm.
remember when he was talking
Right.
about building it back when we were meeting with him in 2022,
Yeah.
he had folks from the Native community as part of their conversation and part of their
Yep.
team. and we're going to work together because they couldn't afford to do two. And so how could they be welcoming to that community? And that's what we're talking about here. So thinking forward, what other thoughts did you have on this subject you wanted to chat about? I think we've seen this model, haven't we? Or thinking about like the hub model and getting people together. Where have we seen that when we've been out and about
But,
working besides North Dakota?
well, I was going to contrast it with kind of what the architects are fighting against, and that's
Mm.
pop-up clinics and building, in a
Oh,
strip mall or building a clinic on the interstate exit. I can think of several dentist offices that popped up on interstate exits, even in my own community, here in
mm,
Iowa, because they want to draw more people in, right? It's not walkable next to a McDonald's. And there's a real pushback from some of these architects who are like, if we want it to be part of the community, that's not creating that community sense. And it kind of goes back to the barbershop model, right? Everyone just feels comfortable walking in to their barbershop or your hair salon. And I think of on Main Street in the small town I live in, I think there's 3 or 4 barbershops or salons on Main
yeah.
Street. Right? I mean, because it's right in the center of town. Everyone's going in and out. They're busier places. And so, why aren't we creating those same hubs around healthcare or putting them in those places where we have that natural movement? And so, that's the themes that we hear in some of the presentations we hear when we have
Mm.
conversations with folks. And I think it really does help us to take pause and think about, are the places you go to, are they walkable? Do you want to spend time there, or are they just giant parking lots in a strip mall? I avoid places that are giant strip mall places a lot of times because I prefer to walk or prefer to be somewhere that has more aesthetic.
Yeah.
And so when you think about where you want to be, is it close to a gym? Is it close to a grocery store? Is it close to a cafe with healthy food? All of those things need to be taken into account.
Well, and you think about some of our biggest grocery stores in Iowa, the one of the biggest chains has done that with their putting the pharmacy in and putting restaurants in
Mhm.
and things because most of us we all have to grocery shop whether we like it or not. And so I'm sorry, it's easier for me to get a flu shot if I have to go get groceries and just get it done all at
Yeah,
once than to go find a
yeah.
standalone pharmacy someplace else that may or
Mhm.
may not be able to get me in. And so, sometimes that's just easier. And so it's easy. We're
Mhm.
shopping anyway to pick up the prescription, to get the flu shot. In some of the big, big box stores, what they've added optometry to that in hearing loss clinics.
Mhm.
And so that people going to shop at some bigger clinics, you can get discounts for that for the bulk shopping, but also discounts for new glasses or new hearing aids. Some of these groups really are doing a very good job of trying to meet the needs because people are going to
Mhm.
come to those places anyway. So to get some of those primary things accomplished, you can do it while you're there. The spouse can keep on shopping and the other person can get the glasses or their hearing check or whatever they need done and keep moving because it is really hard. My optometrist is in a strip mall and I go there if I have to, but it's like there's no reason to stay. I'm in the car, out the car, and out the door. It's not
Mhm.
really like a welcoming place you want to go. But when I go to the
Mhm.
box store and there, I mean, I'm shopping too, and so then I can get my glasses, and then like, well, can you come back in so many minutes because you got to get these fixed? Like, sure, and then you go do something else and can walk right back, and you're out walking and doing things. So there are some really smart ways to think about it. I don't really get the dentist at the end of the highway. That's kind of weird, but maybe they're trying to just be seen, or maybe it's more like emergencies, but that's just weird. They seem
Well,
like kind of
yeah,
isolated.
or they bounce from clinic to clinic to clinic down the interstate, right? So you have some
Mm,
specialty clinics that do that. So they open multiple buildings.
that's weird.
It's just something to think about. When you think about your own community, it's an opportunity for you to get involved. Your local city councils or your local planning and zoning folks. All of this matters to the health of your community. And when we talk about social drivers of health, it directly relates to this conversation. And so we often, we spend a lot of time talking about behavioral health. We talk a lot about having access to therapists or specialty care, but your environment is really important. And it's one of the biggest drivers of the social determinants of health. And so, I think today's discussion really gets us back to how you plan your community and how your community is built out and what you have access to in your local community, whatever you define that as, has a big impact on your health. And we don't always take that into account.
It does. So moving forward, now we're going to talk about the recovering politician self-care policy of the week. And there's two parts to this. First, I had to pick a new activity for the summer because it's too hot to be outside. I'm a whining wimp, but I don't like biking or running when it's 90 degrees and all the humidity, thanks corn and all that. No, thank you. So I went back to the pool. Pool's nice. I can do that all year round. Indoor, outdoor, doesn't matter to me. And I prefer it when it's not freezing cold. For me, my hair freezes afterwards. I don't like that. So the summer is really the best time for swimming. So I had to do that. But when I was in the pool, I was thinking about kind of funny because I wasn't thinking about this per se, but there's a group of people I hadn't seen in a really long time. And they're using the pool and walking up and down, just what we're talking about here, that social hub, that connection to not be isolated. And they're people I've known for years at the gym. And they're not like the stringent gym, crazy go at it people, but they come for socialization. And the same is true with my water classes, my aqua classes that we teach. We allow them to talk through those classes because the social connection is as important, if not more important, of women of a certain age and men of a certain age. And so we're really trying to build that. So they add social events before or after, like teaching opportunities, or, maybe they offer bingo or whatever to try to draw those guys in so that there's a social. So using your gym, if you have a gym, one of the things you can do with it, besides just working out for yourself, is to build that social connection. You don't have to be isolated. So it's fun to see people use the pool. If I'm swimming, I'm by myself, but if I'm not and I'm walking the pool or doing a class, then I'm social. And so you have the opportunity to use it how it works best for you. So Jason, have you reflected on anything you're doing? It's got to be too hot to run right now. It's got to be ridiculous.
No, I mean, you power through it. On some of this stuff, we've been traveling a lot. I have rented bicycles lately, and it's not something I've done in the past.
Nice.
So,
Nice. At least you
it's
get a
really
breeze
nice
on a
when,
bike. Get a
well,
breeze, you get a
it's another
breeze.
one of those community things. When communities have good bike trails and they have the community bikes that are out in the rack and you just get on an app. I mean, for $6, I rented a bike for 2.5 hours, rode 10
Cool.
miles, stopped and ate somewhere. That's really economical. And what a great way to get out and experience a local community, drive around on a nice bike trail. So, when communities are designed for activity and getting you out, then you're more likely to engage in those activities. So, I think that's, again, kind of goes into the conversation of when it's accessible and available, are more people likely to do it? Absolutely so.
Yeah. So today we talked about a little bit of a different slant, but talking about buildings and architecture and how it impacts our health and thinking about social determinants of health. And because isolation is so high in our country and trending that direction, how can we, make changes to that? And part of that is how we design our community. And Jason gave a lot of different examples of ways that it's gone well and ways that it have not gone so well. And so we look forward to seeing you next time. But before we go, please don't forget to follow us on LinkedIn, Facebook, or YouTube. If you could leave us a positive review, we'll send you a prize. Have a great day.